Ian, it's your turn.
Yes, immediately. So thank you very much, Sofia. I would like, before starting, actually, to say that I'm very happy to be here, and I would like to thank ΕΛΛΟΚ for the kind invitation of bringing us here. I think from our perspective, we bring like a similar structure to what you have seen, but as Hugo said, each structure has its own kind of lifetime. It has its own kind of structure. So there is no one size fits all, I think. And I think I will now show you what we are doing, because we take maybe a little bit of a different route to what you have listened from the previous speakers. So my name is Gauci Borda, and I come from Scienza Malta, but I am also very much involved now in the setting up of Malta's National Cancer Mission Hub, which has been newly set up. So as Sofia said, we come from one of these kind of newer countries where we did not have a hub-like structure before, so we had no structures before, and with Greece and Portugal, I think we were one of those few countries where we started from absolute zero. So just to give you an overview, our National Cancer Mission Hub is all about having this kind of multifaceted approach where we combine strategic planning, resource allocation, and fostering a collaborative environment. So we were seeing a lot of fragmentation in our system. So there were the care providers, there are the NGOs, and Malta being a very small country, and probably Greece would see this on your islands. That when you have one hospital on an island, for instance, because Malta is probably as big as one of your islands, your hospital can be quite limited. The good news is that for Greece, you can easily travel to Athens. For Maltese, it's different, because for Maltese, to get the full care, for example, for certain cancers, like, for example, brain cancer, for instance, or transplants. So these are all treatments which are not provided on the island. So the only option is to take our patients abroad, and we have patients in Rome, in Milan, in London, in Germany. So we depend on foreign hospitals a lot. So our resources are extremely small compared to the task. They are so small that it is inevitable that for Malta we need to kind of have a good policy mix in terms of the treatment, of the investments that are made, and we have quite a good support structure to do it. So this is why the need for the hub really came up, because like this we could really make everything in parallel. So bringing everyone in one line. So the hub is like bringing everyone through one channel. You have the researchers, you have the healthcare providers, you have the patients, and the hub, this is a kind of home for all these stakeholders. We have a similar structure, so we built it around pentahelix. We make sure that there is the health, the public, the industry, the civil society, and the academic. We also have an advisory board, which is kind of external. And we had a problem, because in Malta, since I told you that we take our patients abroad a lot, we have a very good support structure. And we have the National Cancer Platform, which is a kind of association of NGOs that pay, for example, for the accommodation of patients abroad, for the medication of patients abroad, for transport, for instance, going back and forth to the hospitals. So that is all kind of paid through NGOs. So we thought that the National Cancer Platform should have an important role in this hub, and we put it part of the advisory role of the advisory board. For the time being, we have established a number of arms. So we have an administrative arm, we have a research arm, We have a training arm, and we have an outreach to stakeholders for the time being, but this will be growing. So as you'll see in the next slides, things are moving quite fast in Malta. Maybe it's an advantage because we are such a small country, but I am sure that if the same logic is put into larger countries, I am quite confident that the same speed would probably be experienced. So this is a kind of timeline. As you can see, we started in July 2023 when there was just the first discussions. ECOS had just started. We said that, look, there are these hubs that maybe it could be a solution for Malta. We raised it immediately to the highest political level, so to the Minister of Health, to the Parliamentary Secretary for Research and Innovation, to the Prime Minister, and everyone was quite enthusiastic about it. By October, we already had a budget of 1.2 million to set it up. The deed was signed and the hub was launched in April without any staff or anything. In May, we signed an agreement between the hub and the National Funding Agency, and it was assigned the role that it will take up the role of the National Cancer Mission Hub by the relevant ministries. And we launched a cancer research program. So the cancer research program is a small program which kind of funds cancer research in Malta on the national level. And it is run by Scienza Malta. We had the first inception dialogue with the policymakers in July. And then we had the first inter-hub meeting with the Oslo cluster, where we went to have a kind of bilateral meeting with them to understand how they develop their operations in Oslo. And immediately in October, we were given a kind of nod by the government, a second nod, where the government pledged to put in 1.6 million again for 2025. And we had the second inception dialogue in November, and we awarded the first tranche of projects under the Cancer Research Program in December. These are the topics that went into the first call for the Cancer Research Program. So there were a total of 12 proposals received. You will see the numbers are quite small, but you have to appreciate that the size of the country as well. So I just wanted to put this disclaimer. And we chose 4 proposals, 2 from the academic field and 2 from the private sector, and the grant agreements were signed in December. This is a little bit about the inception dialogue, which is run by ECOS and by the observatory. They helped us to kind of bring the policymakers together to see what we want to see from this hub, and these were quite useful actually, and I would recommend that a similar dialogue is done also in Greece, because first of all it brings everyone together, and it brings everyone also a little bit in line, because when you have 2 or 3 individuals taking the lead and the others following behind, sometimes you tend to lose those following behind. So this was a way to bring everyone on board and everyone to understand how the hub should look like. So we involved them in kind of this co-creation of the hub. We had a second inception dialogue, but this time we went to the stakeholders, we went to the private sector, we went to the NGOs, and I'm quite proud of what you see on the left-hand side. Those are all the companies, the NGOs, the charities, etc., who participated in the event, and we assigned them as founding foundations of our hub. This was held in November. Something that we did already was to have this vehicle, this van. We bought a van where we are going to do this kind of roadshow with local councils, schools, sports clubs, patients groups, and larger activities. And you can already see the van. So we had the first event already 2 weeks ago. It was the first time it was used. It was used in a sports event. There was a football match, and we were invited to send the van, and it was the first time it was used. The person you see in the middle is the Parliamentary Secretary for Research and Innovation. So what are the prospects for 2025? So immediately we have started. So next week we will launch already the 2025 Cancer Research Program. I remind you we have 1.6 billion to do that. We have last year already participated in 2 cancer mission calls, and we were successful. And now we are in the Candle project, where we have been assigned also by the minister to become the national cancer node for Malta. So the portfolio is growing quite fast, I must say. And then the EU SIP project, where we are the work package leader on foresight and sustainability of the European patient data portal. And we foresee to have stakeholder events when the cancer mission calls are launched. So we foresee these to happen around April or May. We will continue with the roadshow. So the roadshow will be one of the hallmarks of the hub, where we will be visiting the different events. And we're also taking up a recruitment drive, and we have a list of experts who would like to rope in, because obviously we are not experts in everything, but we have a list of experts we are going to recruit as part of the hub to help us with the eventual operation. I think that was my last slide. So thank you.
Thank you.